Thank you so much, Mr. Chair. And I understand this bill is a candidate for suspense. Would like to briefly comment on the fiscal costs associated with this bill. There are almost 5,000 kids statewide with severe, long-term, complex, and catastrophic health needs eligible for Medi-Cal in-home nursing care. Most of these kids are medically fragile or permanently disabled. In-home skilled nursing care allows these kids to be safely discharged from expensive ICU level hospital care. Having these young and vulnerable patients taken care of in their own homes is better for the child and for the families. It is also, frankly, better for the state. It costs about 10 times more each day to care for a child in a hospital than it does to care for a child at home. Over the last decade, we've seen growing barriers to accessing home care. There's two major reasons for that. Right now, there are about 1,200 in-home care agencies in California. Only 400 of those agencies actually take Medi-Cal. Only 300 of the 400 take pediatric Medi-Cal. And we have out-of-date reimbursement rates, which means we cannot recruit nurses with a unique combination of skills and this has resulted in waiting lists that can last for years. And in some counties, frankly, aren't any agencies to be able to care for our sickest children. Washington State's Department of Medicaid estimated that a hospital stay for this population is $5,000 per day, compared to $500 per day for in-home nursing. And we do anticipate even higher savings in California if the department actually got back to us from our December and March inquiry. SB 1401 proposes a 3-year pilot program aimed at getting at the bottom of this issue. So what we know is the lack of pediatric in-home care nurses has impacted accessibility, and we do believe that this 20% would provide agencies the opportunity to receive a better wage for the nurses that would be employed by them. We estimate this cost at $10 million. Our original cost was at $7 million. The analysis price tag includes home health aides and supervisor benefits. This bill, though, will only apply to rate increases for nurses. We look forward to working with the committee to make this clarification. Any contribution by the state, by the way, at a very minimum, would be matched dollar for dollar. So the real implementation for the pilot project would be about $20 million. The state share on a conservative estimate would be about $10 million, but we do know that there are some higher matches, and we do believe that we could qualify for that as well. We do have several folks in support that will be briefly mentioning that as well.
Thank you. Witnesses in support.
Mr. Chairman, members, Randy Perry with Aaron Reed and Associates on behalf of the California Children's Hospital Association. The senator went through the costs and what we believe will be savings after this pilot is completed. In 2013, only half of the HHAs offered pediatric Medi-Cal services, and of those, 60% only provided less than a quarter of the services or the hours needed. So this is something that is desperately needed by our critically acute children that we take care of, and we ask that you support the bill. Thanks.
Thank you. Next witness.
Peter Kellist on behalf of the California Association for Health Services at Home, the association that represents home health agencies. If the bill were to entice more home health agencies to provide pediatric care services, would increase the number of kids that could receive it in home, that would be less costly than an institution. For these reasons, we support the bill.
Thank you.
Good morning, Mr. Chairman and members. Paul Bauer with Mercury Public Affairs on behalf of Premier Health Services in support of the bill today. We are a provider under the current scheme, but it's getting harder and harder to find staffing at the levels which have not been raised in over 15 years. So we appreciate all the support from the committee and the author. Thank you.
Thank you. Additional witnesses in support.
Mr. Chairman and members, Chris Frank with Maxim Healthcare Services in support.
Thank you.
Erin Kelly on behalf of the Children's Specialty Care Coalition, representing nearly 2,000 pediatric subspecialty physicians that care for kids with complex health care needs, in support of this measure.
Thank you. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Senator Bates.
Just a quick comment, Senator McGuire, I certainly support the direction you're going in wholeheartedly. This past week, I did have a visit at my district office from one of the parents with their child in Orange County, and the concern is, and I know it's been expressed to you, but would appreciate your consideration of opportunity to expand this at least to Southern California. Their concern is that raising the reimbursables to those north of that very southerly part will be a magnet for those home health providers. There won't be any in Orange County, San Diego. So I know that increases the cost, but it is a critical issue because there's not enough facilities where these individuals be able to be admitted to a hospital. And seeing this young girl, she was 6, I mean, she cannot survive without someone 24/7. So if you take a look at that, it would be very helpful to those of us who are living quite south of LA.
Thank you, Senator Bates. Any other comments or questions? Well, it's just you and I. Senator McGuire, would you like to close?
Thank you so much, and I do appreciate the Vice Chair's comments on that. It's been very difficult to be able to look at the pilot project region, and the reason why those counties were chosen is because they have the highest number of kids who need access to services. Now, at the same time, though, it does not mean that Orange County is not significantly underserved, and you're absolutely right. Would love to be able to have a further conversation with you about this. But the big picture is this. We have folks that are quitting their jobs to be able to care for their kids, which puts them under government assistance. Plus, we're putting these kids into NICU units that are costing taxpayers significant money. But the bottom line, though, we are not delivering the care that we should be. What we know is we can deliver the right care at a less expensive price. It's been 15 years since we've had a rate increase. In fact, we saw a rate decrease in 2009. So would respectfully ask for an aye vote if it were to come off of suspense.
Thank you. Without objection, we move this item to suspense file. As we're waiting for Senator Bell, we're going to move through the agenda on all the waived items. We're going to begin with Senator Block's item, SB 821, witnesses in support, witnesses in opposition, finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to Senator Pan's item, SB 877, witnesses in support, witnesses in opposition, finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to a suspense file. Moving on to Senator McGuire's 2 items, SB 982, witnesses in support, witnesses in opposition, finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1220, witnesses in support, witnesses in opposition, finance.
No file.
Without objection, we move, comments or questions from committee? Seeing none, without objection, we move this item to suspense file. Moving on to Senator Wessel's 2 items, SB 984, witnesses in support, witnesses in opposition, finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1207, witnesses in support, witnesses in opposition, finance.
We're neutral on this bill as it extends the sunset on an existing revolving loan program. The Energy Commission estimates the costs associated with the bill are minor and absorbable within existing resources because the bill continues that existing program. The current governor's budget includes approximately $2.5 million to support the related state operations.
Thank you. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to a suspense file. Moving on to Senator Hernandez's Senator Hernandez's items, beginning with SB 1010, witnesses in support, witnesses in opposition, finance.
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to a suspense file. Moving on to SB 1094, witnesses in support, witnesses in opposition, finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to a suspense file. Moving on to SB 1236, witnesses in support, witnesses in opposition, finance.
The Department of Finance is opposed to this bill because it may result in unknown state general fund costs to reimburse the City of Industry for costs imposed by the provisions of the bill. We see a mandate, and the magnitude of the potential general fund cost is unknown, since the provisions of this bill would only apply to the City of Industry.
Comments or questions from committee? Seeing none, without objection, we move this item to a suspense file. Moving on to Senator Hancock's items, SB 1024. Witnesses in support.
Yes, Mr. Chair and members, Bob Giovanni with the State Council on Developmental Disabilities. We are the proud co-sponsors. We are in support. Thank you.
Thank you. Additional witnesses in support.
Thank you. Catherine Brandenburg with representing the County of Alameda. We're in support.
Thank you. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Hancock's SB 1031. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Runner's items, beginning with 1075. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1228. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Allen's item, SB 1107. Witnesses in support. Witnesses in opposition.
No file.
Finance. No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Senator Bell, are you prepared to take up? Are you ready for? Okay. Members, we're going to take up the Transportation and Housing Committee Omnibus Bill. That is SB 944. Senator Bell, the floor is yours.
Good afternoon, Mr. Chairman, members. As chair of the Senate Transportation Housing Committee, I'm here to present SB 944. This is the omnibus bill. The bill contains technical and non-controversial changes to various committee-related statutes into one bill. The Senate Committee on Transportation Housing requires that its housing omnibus bill be a consensus measure. And of course, if there's no consensus on a particular item, it will not be included in the bill. There is no opposition. We had unanimous support in the committee. I respectfully ask for an aye vote.
Move the bill.
Thank you. There is a motion. It does enjoy a due pass recommendation. Witnesses in support. Witnesses in opposition. Finance.
We believe the bill would be minor and absorbable costs.
Thank you. There is a due pass recommendation. Senator Bell is asking for a support. Secretary, please call the roll.
Laura?
Aye.
Laura, aye. Bates?
Aye.
Bates, aye. Bell? Bell, aye. Hill? McGuire? McGuire, aye. Mendoza? Mendoza, aye. Nielsen?
Currently 5-0. We'll leave that item open to allow our absent members to add on. We're going to move now to Senator Leno's items, beginning with SB 1143. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1202. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committees? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1232. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to Senator Liu's item, SB 1154. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Galgiani's item, SB 1176. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Hill's item, SB 1193. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Wajkowski's item, SB 1213. Witnesses in support. Witnesses in opposition. Finance.
The Department of Finance is opposed to this bill because it's inconsistent with the administration's cap-and-trade expenditure plan. The bill continuously appropriates $20 million annually from the GGRF to the Energy Commission for the Biosolids to Clean Energy grant program created by this bill. The Energy Commission estimates that it will require $355,000 to $450,000 annually to fund 4 positions to create and implement this new grant program. We think that that estimate's reasonable.
Thank you. Comments or questions from committee? Seeing none, without objection, we move this item to suspense file. Moving on to my 2 items, SB 1227, witnesses in support, witnesses in opposition. Finance.
We're neutral on this bill, and we believe that the costs are minor and absorbable to the core.
Thank you. Without questions or comments from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1383, witnesses in support, witnesses in opposition. Finance.
The Department of Finance is also neutral in this bill, which aligns with the governor's budget and priorities, and the administration continues to coordinate with your office on the bill. The Air Resources Board states that the fiscal impact of this legislation will be minor and absorbable.
Thank you. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1234 by Senator De Leon, witnesses in support.
Deputy Treasurer Grant Boykin, on behalf of State Treasurer John Chung, who has chaired the Secure Choice Retirement Savings Investment Board, urge you on his behalf to support.
Thank you. Witnesses in opposition. Finance.
The Department of Finance has not yet taken a position on this bill. The administration is very interested in the savings concept, but we have a number of concerns. First and foremost, that the Department of Labor has yet to finalize its ERISA safe harbor rule, without which there would be significant liability exposure for the state and employers. We're also concerned that the feasibility study significantly understated the operational costs of administering, enforcing, and marketing the program. We're continuing to develop our own estimates on those. As the bill moves forward, we'll be looking to make sure that the state is protected from liability and risk, and that participants in the program understand that they're investing in the market and that this program is not a state benefit with a guarantee. We look forward to continuing to work with the author to reconcile these concerns.
Thank you. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Walk's items, SB 1316, witnesses in support, witnesses in opposition. Please come forward.
My name is Scott Aker, and I represent Prolecta Bioscience. We're opposed to SB 1316 unless amended because this bill would reduce the supply of a one-of-a-kind product that's been reported to reduce morbidity and mortality in infants weighing less than 1,250 grams at birth. A study conducted in 2012 using data from the Medi-Cal database showed that hospitals save $8,167 per baby and 3.9-day reduction in length of stay when they use Prolactis products. The bill, if passed, without amendments, would increase the cost of NICU care in California because it jeopardizes approximately 17.9% of the milk that Prolacta collects. This data comes from our internal analysis, which was requested by the Senate Health Committee at the hearing on SB 1316 3 weeks ago. When it was made clear that the bill is not designed to cut off Prolacta's milk supply. We asked the committee to adopt the amendment exempting milk-based human milk fortifiers from the 90-day remuneration prohibition. The second amendment we're asking the committee to adopt would enhance the safety and regulation for the collection, processing, and sale of human milk in California. Prolacta screens all of its donations for drugs of abuse, which includes opiates that might be prescribed to a mom who receives a C-section. We also screen for nicotine, and both of these drugs have been found in milk that we've received from both remunerated and non-remunerated donors. And so we ask that the committee accepts the amendment to include that type of screening in the bill. And we respectfully request that the committee hold this bill until the committee has resolved these issues.
Thank you.
I brought a donor with me who's also impacted negatively by this bill.
Thank you.
My name is Diana Nordine. I have 3 small children of my own, and I teach middle school. As of today,
Can you come to the front? easier for us to hear you this way.
Okay.
Thank you.
As of today, I've donated and sold over 5,000 ounces of excess breast milk to countless other infants through milk sharing sites, private classified listings, friends, as well as Prolacta Bioscience. While it's true I have an oversupply of milk, ensuring long-term supply takes unyielding commitment. Any woman who is willing to subject herself to all this is a person who deserves to be trusted to make healthy decisions for herself and her baby. For 43 months now, so that babies in need can receive breast milk instead of formula, I have sacrificed approximately an hour of sleep and pumped 2 to 5 times daily to keep my milk in good supply. I shoulder this responsibility so that when 2 of my own friends couldn't meet their own baby's demand, I could bridge that gap. Mothers can choose to continue breast milk because of my commitment and sacrifices around the clock to breastfeeding. You can't tell me a woman doesn't warrant payment for such work. A man can donate sperm and be fairly compensated without anyone questioning his ability to make a well-informed decision, stripping him of the term of donor, or imposing a moratorium on donations for 6 months after fathering a child. To suggest an underprivileged woman will make these commitments day in and day out, sell her own milk to someone else's baby for about $1 an ounce, and then give her own baby formula purchased with public assistance is far-fetched. I believe that I've more than earned every penny for which this surplus of milk has sold. It has repaired the leaky roof over my children's heads and paid for new tires on the car that drives them to doctor's appointments. It is no windfall, but in this way I can further support my family while making sure my own baby's supply of breast milk will not diminish. To suggest women need legislation dictating how they may use their own bodily fluids is both offensive and ludicrous. Thank you.
Thank you. Appreciate your testimony. Any additional witnesses in opposition? Finance?
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Wilk's SB 1414. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Pavley's items. SB 1425. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1427. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Hall's item, SB 1426. Witnesses in support.
Mr. Chair and committee members, Mike Velasco on behalf of Wine Institute, we support the bill.
Thank you. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Hertzberg's item, SB 1444. Witnesses in support. Witnesses in opposition. Finance?
We don't see any additional costs to this bill.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to our last item on the agenda by our very own Vice Chairwoman, Senator Bates, SB 1476. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Members, at this time, we're going to go through our open items to make sure everybody has a chance to vote on the measures that haven't voted. Our first item is thank you. Beginning with Senator Nguyen's item, SB 1012. Secretary, please call the roll.
The motion is due pass to the Senate floor. Bell? Aye. Bell, aye. Nielsen? Aye. Nielsen, aye.
7-0, that item is out. The next item is SB 944 by Senator Bell. Call the absent members.
The motion is due pass to the Senate floor. Hill? Aye. Hill, aye. Nielsen?
Senator Bell's item, the committee bill.
Aye.
Nielsen, aye.
7-0, that item is out. Moving on to Senator Hernandez's item, SB 1076. Secretary, please call the absent members.
The motion is due pass to the Senate floor. Bell? Aye. Bell, aye. Nielsen? Aye. Nielsen, aye.
6-1, that item is out. Moving on to Senator Mendoza's item, SB 1072. Secretary, please call the absent members.
The motion is due pass to the Senate floor. Bell? Aye. Bell, aye. Nielsen?
Aye.
Nielsen, aye.
7-0, that item is out. Moving on to Senator Leiva's item, SB 1106. Secretary, please call the absent members.
The motion is due pass to the Senate floor. Bell? Aye. Bell, aye.
7-0, that item is out. This concludes our appropriation meeting for today. Thank you, members.